Ophthalmia neonatorum. Introduction. Ophthalmia neonatorum, also known as neonatal conjunctivitis, is a condition characterized by inflammation of the conjunctiva in the eyes of newborns within the first month of life. This condition, if left untreated, can lead to serious complications and long-term visual impairment. In this section, we will delve into the various aspects of ophthalmia neonatorum, including its definition, etiology, clinical features, risk factors, sequelae, investigations, treatment, management, prevention, and precautions. Definition. Ophthalmia neonatorum refers to an acute purulent conjunctivitis in neonates, typically appearing during the first few weeks of life. It is most commonly caused by infection, particularly with the bacterium Neisseria gonorrhoeae or Chlamydia trachomatis, but can also result from other pathogens. Etiology. Neisseria gonorrhoeae. This bacterium is one of the most virulent causes of ophthalmia neonatorum. It can be transmitted to the baby during passage through an infected birth canal. Chlamydia trachomatis. Chlamydia is another significant bacterial cause, often leading to milder symptoms compared to gonococcal infection. It is typically transmitted from the mother to the infant during childbirth. Other pathogens. Ophthalmia neonatorum can also be caused by other bacteria or viruses, though less frequently. These may include Streptococcus species or herpes simplex virus. Clinical features. The clinical presentation of ophthalmia neonatorum can vary depending on the causative organism, but common symptoms and signs include eyelid redness and swelling. The infant's eyelids become inflamed and may appear red and swollen. Watery or purulent discharge. There is often a discharge from the eyes that can range from clear and watery to thick and purulent. Conjunctival injection. The conjunctiva, the thin membrane covering the white part of the eye, becomes congested and red. Photophobia. Affected infants may be sensitive to light and blink excessively. Corneal involvement. In severe cases, the cornea, the clear front part of the eye, may become affected, leading to corneal opacities and visual impairment. Risk factors. Several factors increase the risk of ophthalmia neonatorum, including maternal infection. Mothers with untreated gonorrhea or chlamydia infections are more likely to transmit the bacteria to their newborns. Lack of prenatal care. Insufficient prenatal care increases the chances of maternal infections going undetected and untreated. Prolonged rupture of membranes. When the amniotic sac breaks prematurely and labor is delayed, the baby is exposed to infection for a longer duration. Multiparity. Due to increased exposure to pathogens during childbirth. Sequelae. If left untreated, ophthalmia neonatorum can lead to severe consequences. Corneal scarring. Chronic inflammation can cause corneal scarring, leading to visual impairment. Corneal perforation. In rare cases, severe infections can lead to corneal perforation, requiring urgent surgical intervention. Blindness. In the absence of timely and appropriate treatment, ophthalmia neonatorum can result in permanent blindness. Investigations. Diagnosing ophthalmia neonatorum typically involves clinical examination. A thorough examination of the baby's eyes by a healthcare provider. Microbiological testing. Conjunctival swabs or cultures may be taken to identify the causative organism. Treatment. The choice of treatment depends on the causative agent and its sensitivity to antibiotics. Common treatments include topical antibiotics, Eye drops or ointments containing antibiotics are administered to treat the infection. Systemic antibiotics. In severe cases or when systemic involvement is suspected, systemic antibiotics may be prescribed. Supportive care. Keeping the eye clean and free from discharge is essential for recovery. Management. Isolation. Infants with ophthalmia neonatorum should be isolated to prevent the spread of infection. Follow-up. Regular follow-up with a healthcare provider is crucial to monitor progress and adjust treatment as needed. Prevention and precautions. Preventing ophthalmia neonatorum is key, and this can be achieved through various measures. Prenatal screening. Pregnant women should undergo screening for sexually transmitted infections, and treatment should be administered if infections are detected. Prophylactic eye ointment. Applying prophylactic antibiotic eye ointment to all newborns immediately after birth helps prevent ophthalmia neonatorum, even if the mother is not known to have an infection. Safe delivery practices. Ensuring safe childbirth practices, including timely rupture of membranes and appropriate hygiene, can reduce the risk of transmission during birth. Summary, shorter explanation. Ophthalmia neonatorum, also known as neonatal conjunctivitis, is characterized by bilateral inflammation of the conjunctiva in infants, less than 30 days old. A preventable disease occurring due to carelessness at the time of birth. Any discharge or even watering from the eyes in the first week of life can be a warning sign of ophthalmia neonatorum, as tears do not form till then. Etiology, sources and modes of infection. 3 ways. 1. Before birth, infection is rare through infected liquor amni in mothers with ruptured membranes. 2. During birth, in vaginally delivered infants, the most common mode of infection is from the infected birth canal, especially when the child is born with face presentation or with forceps. 3. After birth, infection may occur during the first bath of newborn or from soiled clothes or maybe from fingers with infected lochia. Causative agents include 1. Chemical neonatal conjunctivitis, incubation period is 6 hours. Silver nitrate or antibiotics were the common causes. 2. Gonococcal infection, incubation period is 2 to 5 days, was considered a serious disease in the past, as it used to be responsible for 50% of blindness in children. 3. Other bacterial infections, incubation period is 5 to 8 days. A Staphylococcus aureus, Haemophilus species, Streptococcus hemolyticus, and Streptococcus pneumoniae. 4. Neonatal inclusion conjunctivitis, incubation period is 5 to 14 days. Caused by serotypes D to K of Chlamydia trachomatis is now the most common cause in developed countries. 5. Herpes simplex induced ophthalmia neonatorum, incubation period is 6 to 15 days. Is a rare condition caused by herpes simplex 2 virus from infected birth canal. Signs and symptoms include tenderness and pain in the eyeball and conjunctiva. Lids are usually swollen in infective cases. Discharge may be present. Conjunctiva may show hyperemia and chemosis. Complications, if left untreated, especially of gonococcal ophthalmia neonatorum, may develop corneal ulceration, which can perforate rapidly, resulting in staphyloма formation or corneal opacification. Prophylaxis needs antenatal, natal and postnatal care. Antenatal measures include treatment of genital infections. Natal measures include deliveries should be conducted under hygiene. Newborn babies' closed lids have to be cleaned and dried. Treatment includes usage of antibiotics or antiviral eye drops.